Migraine versus headache. A migraine episode is different from a typical headache. The experience is different, and they can have different causes. Writing down the symptoms and when they occur can help a person and their doctor to identify migraine episodes. Keep this journal for at least 8 weeks, and note down the time that symptoms start. Possible triggers, such as stress or menstruation. The nature of the headache, any other symptoms, how long the symptoms last. Any noticeable indicators of migraine, such as aura. Any medications and their effects. A migraine is much more than a bad headache. This neurological disease can cause debilitating throbbing pain that can leave you in bed for days. Movement, light, sound and other triggers may cause symptoms. Symptoms like pain, tiredness, nausea, visual disturbances, numbness and tingling, irritability, difficulty speaking, temporary loss of vision and many more. A migraine is usually a moderate or severe headache felt as a throbbing pain on one side of the head. Many people also have symptoms such as feeling sick, being sick and increased sensitivity to light or sound. Migraine is a common health condition, affecting around 1 in every 5 women and around 1 in every 15 men. They usually begin in early adulthood. There are several types of migraine, including migraine with aura, where there are specific warning signs just before the migraine begins, such as seeing flashing lights. Migraine without aura, the most common type, where the migraine happens without the specific warning signs. Migraine aura without headache, also known as silent migraine, where an aura or other migraine symptoms are experienced, but a headache does not develop. Some people have migraines frequently, up to several times a week. Other people only have a migraine occasionally. It's possible for years to pass between migraine attacks. Causes of migraines. The exact cause of migraines is unknown, although they're thought to be the result of temporary changes in the chemicals, nerves and blood vessels in the brain. Around half of all people who experience migraines also have a close relative with the condition, suggesting that genes may play a role. Some people find migraine attacks are associated with certain triggers, which can include starting their period, stress, tiredness, certain foods or drinks. What are the types of headaches? There are over 150 types of headaches, divided into 2 categories, primary headaches and secondary headaches. A migraine is a primary headache, meaning that it isn't caused by a different medical condition. Primary headache. Primary headache disorders are clinical diagnoses, meaning there's no blood test or imaging study to diagnose it. A secondary headache is a symptom of another health issue. An aura is a group of sensory, motor and speech symptoms that usually act like warning signals that a migraine headache is about to begin. Commonly misinterpreted as a seizure or stroke, it typically happens before the headache pain, but can sometimes appear during or even after. An aura can last from 10 to 60 minutes. About 15% to 20% of people who experience migraines have auras. Aura symptoms are reversible, meaning that they can be stopped or healed. An aura produces symptoms that may include seeing bright flashing dots, sparkles, or lights, blind spots in your vision, numb or tingling skin, speech changes, ringing in your ears, tinnitus, temporary vision loss, seeing wavy or jagged lines, changes in smell or taste, a funny feeling. What are the types of migraines? There are several types of migraines, and the same type may go by different names. Migraine with aura, complicated migraine. Around 15% to 20% of people with migraine headaches experience an aura. Migraine without aura, common migraine. This type of migraine headache strikes without the warning an aura may give you. The symptoms are the same, but that phase doesn't happen. Migraine without head pain. Silent migraine or acephalgic migraine, as this type is also known as, includes the aura symptom but not the headache that typically follows. Hemiplegic migraine. You'll have temporary paralysis, hemiplegia, or neurological or sensory changes on one side of your body. The onset of the headache may be associated with temporary numbness, extreme weakness on one side of your body. a tingling sensation, a loss of sensation and dizziness or vision changes. Sometimes it includes headache and sometimes it doesn't. Retinal migraine, ocular migraine. You may notice temporary, partial or complete loss of vision in one of your eyes, along with a dull ache behind the eye that may spread to the rest of your head. That vision loss may last a minute, or as long as months. You should always report a retinal migraine to a healthcare provider because it could be a sign of a more serious issue. Chronic migraine. A chronic migraine is when a migraine occurs at least 15 days per month. The symptoms may change frequently, and so may the severity of the pain. Those who get chronic migraines might be using headache pain medications more than 10 to 15 days a month. That, unfortunately, can lead to headaches that happen even more frequently. Migraine with brainstem aura. With this migraine, you'll have vertigo, slurred speech, double vision or loss of balance, which occur before the headache. The headache pain may affect the back of your head. These symptoms usually occur suddenly and can be associated with the inability to speak properly, ringing in the ears and vomiting. Status migrainosus. This is a rare and severe type of migraine that can last longer than 72 hours. The headache pain and nausea can be extremely bad. Certain medications, or medication withdrawal, can cause you to have this type of migraine. What are the 4 stages or phases of a migraine? The 4 stages in chronological order are the prodrome, premonitory, aura, headache and postdrome. About 30% of people experience symptoms before their headache starts. The phases of migraine are: 1. Prodrome. The first stage lasts a few hours, or it can last days. You may or may not experience it as it may not happen every time. Some know it as the pre-headache or premonitory phase. 2. Aura. The aura phase can last as long as 60 minutes or as little as 5. Most people don't experience an aura, and some have both the aura and the headache at the same time. 3. Headache. About 4 hours to 72 hours is how long the headache lasts. The word ache doesn't do the pain justice because sometimes it's mild, but usually, it's described as drilling, throbbing, or you may feel the sensation of an ice pick in your head. Typically it starts on one side of your head and then spreads to the other side. 4. Postdrome. The postdrome stage goes on for a day or two. It's often called a migraine hangover and 80% of those who have migraines experience it. It can take about 8 to 72 hours to go through the 4 stages. Can children get migraines? Yes, but pediatric migraines are often shorter and there are more stomach symptoms. Do migraines cause permanent brain damage? No. Migraines don't cause brain damage. There is a tiny risk of stroke in people who get migraines with aura, 1 or 2 people out of 100,000. Migraine risk factors. The American Migraine Foundation estimates that more than 38 million Americans get migraines. Some things may make you more likely to get them. 1. Sex. Women have migraines 3 times more often than men. 2. Age. Most people start having migraine headaches between ages 10 and 40. But many women find that their migraines get better or go away after age 50. 3. Family history. 4 out of 5 people with migraines have other family members who get them. If one parent has a history of these types of headaches, their child has a 50% chance of getting them. If both parents have them, the risk jumps to 75%. 4. Other medical conditions, depression, anxiety, bipolar disorder, sleep disorders, and epilepsy can raise your odds. Migraine triggers. Some common migraine triggers include: 1. Hormone changes. Many women notice that they have headaches around their period, while they're pregnant, or when they're ovulating. Symptoms may also be tied to menopause, birth control that uses hormones, or hormone replacement therapy. 2. Stress. When you're stressed, your brain releases chemicals that can cause blood vessel changes that might lead to a migraine. 3. Foods. Some foods and drinks, such as aged cheese, alcohol, and food additives like nitrates, in pepperoni, hot dogs, and lunch meats, and monosodium glutamate, MSG, may be responsible in some people. 4. Skipping meals. 5. Caffeine. Getting too much or not getting as much as you're used to can cause headaches. Caffeine itself can be a treatment for acute migraine attacks. 6. Changes in weather, storm fronts, changes in barometric pressure, strong winds, or changes in altitude can all trigger a migraine. 7. Senses, loud noises, bright lights, and strong smells can set off a migraine. 8. Medications, vasodilators, which widen your blood vessels, can trigger them. 9. Physical activity, this includes exercise and sex. 10. Tobacco. 11. Changes to your sleep, you might get headaches when you sleep too much or not enough. Migraine frequency. Doctors divide migraine into 3 levels of frequency. 1. Episodic migraine means you get migraine now and then. 2. High-frequency episodic migraine means you get 8 to 14 headache days per month. This condition also makes you more likely than others to develop chronic migraine. 3. Chronic migraine means you have headache on more than 15 days of the month and 8 of those days have migraine features such as moderate to intense head pain. Pain is on side of head, one or both. Pain throbs or pulsates. Pain gets worse when you move. You have nausea or vomiting. You're sensitive to light and sound. About 12% of Americans get migraine from time to time, but only about a third of those have chronic migraine. Chronic and even high-frequency episodic migraine can be disabling conditions. And the higher the pain intensity of each headache, the more disabling it can be. That's why it's especially important to work closely with your doctor on a treatment plan. Are migraines curable? There's no cure for migraines yet. But medications can help prevent or stop them, or keep your symptoms from getting worse. You can also avoid things that trigger your migraines. Lifestyle changes like easing stress and having good sleep habits can help, too. Are migraines fatal? Most migraines don't cause lasting harm. Rarely, you can have a complication called migrainous infarction. That's when you have a stroke while you're having a migraine. But there's no evidence migraine can trigger a stroke. It's extremely rare, but a hemiplegic migraine can sometimes lead to a coma or other serious complications. A very intense headache that starts suddenly can be a sign of another, more serious condition, like a stroke or aneurysm. Get medical help right away if this happens. Complications of migraine. Taking painkillers too often can trigger serious medication overuse headaches. The risk seems to be highest with aspirin, acetaminophen and caffeine combinations. Overuse headaches may also occur if you take aspirin or ibuprofen, Advil, Motrin IB, others, for more than 14 days a month. Or triptans, sumatriptan or rizatriptan for more than 9 days a month. Medication overuse headaches occur when medications stop relieving pain and begin to cause headaches. You then use more pain medication, which continues the cycle. Diagnosis of migraine. If you have migraines or a family history of migraines, a doctor trained in treating headaches, neurologist, will likely diagnose migraines. It will be based on your medical history, symptoms, and a physical and neurological examination. If your condition is unusual, complex or suddenly becomes severe, tests to rule out other causes for your pain might include magnetic resonance imaging, MRI. An MRI scan uses a powerful magnetic field and radio waves to produce detailed images of the brain and blood vessels. MRI scan. MRI scans help doctors diagnose tumors, strokes, bleeding in the brain, infections, and other brain and nervous system, neurological, conditions. Computerized tomography, CT, scan. A CT scan uses a series of X-rays to create detailed cross-sectional images of the brain. This helps doctors diagnose tumors, infections, brain damage, bleeding in the brain and other possible medical problems that may be causing headaches. Treatment of migraine. Migraine treatment is aimed at stopping symptoms and preventing future attacks. Many medications have been designed to treat migraines. Medications used to combat migraines fall into 2 broad categories. Pain-relieving medications, also known as acute or abortive treatment. These types of drugs are taken during migraine attacks and are designed to stop symptoms. Preventive medications. These types of drugs are taken regularly, often daily, to reduce the severity or frequency of migraines. Your treatment choices depend on the frequency and severity of your headaches. Whether you have nausea and vomiting with your headaches, how disabling your headaches are, and other medical conditions you have. Medications for relief. Medications used to relieve migraine pain work best when taken at the first sign of an oncoming migraine, as soon as signs and symptoms of a migraine begin. Medications that can be used to treat it include pain relievers. These over-the-counter or prescription pain relievers include aspirin or ibuprofen. When taken too long, these might cause medication overuse headaches, and possibly ulcers and bleeding in the gastrointestinal tract. Migraine relief medications that combine caffeine, aspirin and acetaminophen, etc. Migraine may be helpful, but usually only against mild migraine pain. Triptans. Prescription drugs such as sumatriptan and rizatriptan are used to treat migraine because they block pain pathways in the brain. Taken as pills, shots or nasal sprays, they can relieve many symptoms of migraine. They might not be safe for those at risk of a stroke or heart attack. Dihydroergotamine, available as a nasal spray or injection. This drug is most effective when taken shortly after the start of migraine symptoms for migraines that tend to last longer than 24 hours. Side effects can include worsening of migraine-related vomiting and nausea. People with coronary artery disease, high blood pressure, or kidney or liver disease should avoid dihydroergotamine. Lasmiditan. This newer oral tablet is approved for the treatment of migraine with or without aura. In drug trials, lasmiditan significantly improved headache pain. Lasmiditan can have a sedative effect and cause dizziness, so people taking it are advised not to drive or operate machinery for at least 8 hours. Albrigepant. This oral calcitonin gene-related peptide receptor antagonist is approved for the treatment of acute migraine with or without aura in adults. It's the first drug of this type approved for migraine treatment. In drug trials, albrigepant was more effective than placebo in relieving pain and other migraine symptoms such as nausea and sensitivity to light and sound 2 hours after taking it. Common side effects include dry mouth, nausea and excessive sleepiness. Albrigepant should not be taken with strong CYP3A4 inhibitor drugs. CGRP antagonists. Albrigepant and riamgepant are oral CGRP antagonists recently approved for the treatment of acute migraine with or without aura in adults. In drug trials, drugs from this class were more effective than placebo in relieving pain and other migraine symptoms such as nausea and sensitivity to light and sound 2 hours after taking it. Common side effects include dry mouth, nausea and excessive sleepiness. Albrigepant and riamgepant should not be taken with strong CYP3A4 inhibitor drugs. Opioid medications. For people who can't take other migraine medications, narcotic opioid medications might help. Because they can be highly addictive, these are usually used only if no other treatments are effective. Anti-nausea drugs. These can help if your migraine with aura is accompanied by nausea and vomiting. Anti-nausea drugs include chlorpromazine, metoclopramide, Reglan, or prochlorperazine, Compro. These are usually taken with pain medications. Some of these medications are not safe to take during pregnancy. If you're pregnant or trying to get pregnant, don't use any of these medications without first talking with your doctor. Preventive medications. Medications can help prevent frequent migraines. Your doctor might recommend preventive medications if you have frequent, long-lasting or severe headaches that don't respond well to treatment. Preventive medication is aimed at reducing how often you get a migraine, how severe the attacks are and how long they last. Options include blood pressure lowering medications. These include beta blockers such as propranolol and metoprolol tartrate. Calcium channel blockers such as verapamil can be helpful in preventing migraines with aura. Antidepressants. A tricyclic antidepressant, amitriptyline, can prevent migraines. Because of the side effects of amitriptyline, such as sleepiness, other antidepressants might be prescribed instead. Anti-seizure drugs valproate and topiramate might help if you have less frequent migraines, but can cause side effects such as dizziness, weight changes, nausea and more. These medications are not recommended for pregnant women or women trying to get pregnant. Botox injections, injections of onabotulinum toxina, Botox, about every 12 weeks help prevent migraines in some adults. CGRP monoclonal antibodies. Oranumab, framinezumab VFRM, galcanezumab GNLM, and eptinezumab JJM are newer drugs approved by the Food and Drug Administration to treat migraines. They're given monthly or quarterly by injection. The most common side effect is a reaction at the injection site. Ask your doctor if these medications are right for you. Some of these medications are not safe to take during pregnancy. If you're pregnant or trying to get pregnant, don't use any of these medications without first talking with your doctor. Home and natural remedies. Some home care strategies that can help relieve migraine symptoms include using flexible cold packs or masks, staying in a quiet, darkened room, sleeping, when necessary. The following supplements might help prevent migraine. However, there is limited evidence that they work, and not much is known about their side effects. Herbal extracts, such as feverfew, magnesium, coenzyme 10, butterbur, riboflavin. Other non-drug approaches may include acupuncture and neck exercises or physical therapy. Before trying any of these, speak with a healthcare professional. Research has not shown that these approaches work. Various products that claim to help relieve migraine are available for purchase online. Anyone looking for an alternative therapy, such as acupuncture, should go to a qualified and experienced professional. While it is not always possible to prevent migraine episodes, there are ways to reduce their frequency and severity. The following prescription drugs may help reduce the number of episodes that a person with severe migraine experiences. Topiramate, an anti-seizure drug, propranolol, for treating high blood pressure, antidepressant medications, Botox, Gepants and CGRP inhibitors. It may take several weeks to see an improvement. The best treatment in children or adolescents may be different from that in adults. Identifying and avoiding triggers. A migraine episode sometimes happens in response to a trigger. To identify a trigger, a person might keep a diary and record how they felt and what they did, ate, and drank before the symptoms appeared. It may be particularly helpful to avoid low blood sugar, physical overexertion, stress. Certain foods, such as chocolate and any that contain tyramine or MSG, certain medications, including HRT and some birth control pills, bright lights and flickering screens. The following strategies may help reduce the frequency of migraine episodes. Getting enough sleep, reducing stress, drinking plenty of water, having healthy posture. Avoiding known dietary triggers, such as caffeine, alcohol, and cheese, getting regular physical exercise. If making these changes does not ease the severity and frequency of migraine episodes, a doctor may suggest medication or other options. Migraine is a medical condition that involves a headache and other symptoms. It is not just a bad headache, and it can have a significant impact on daily life, making it difficult to work and do everyday activities. Identifying and avoiding triggers can often help reduce the frequency or severity of episodes, though it is not always possible to prevent them. Medication and other treatments can help manage migraine symptoms.